Hello, my name is Luke Herbert. I am the Director of Pharmacy at KSB Hospital. Today, I am going to share some information about COVID-19 vaccines. Thank you to KSB Community Wellness for putting this program together. And today, as I record, I want to mention that it is February 11th, and I mention that because we're talking about COVID vaccines, and the information and availability of vaccines have been changing on a fairly regular basis. So Pfizer and Moderna both have vaccines available in the U.S. at this time. They both received an FDA emergency use authorization back in December, a few months ago, and we've vaccinated millions of people since then. I think today I heard on the news that 10% of the U.S. population has received at least one dose of vaccine at this point. So both of these vaccines are mRNA vaccines or messenger RNA vaccines. These two vaccines are actually fairly similar in safety and effectiveness and in the technology of how they're made and how they work. The vaccine studies used to grant emergency use authorization enrolled 44,000 and 30,000 patients respectively. And I mention that because those are large clinical trials by any standard. And being large clinical trials, the data is pretty solid in these studies. The efficacy after the second dose is coming in at around 94 to 95%, which is a very good vaccine efficacy. And so that basically means that the patients that received placebo who were not vaccinated had about a 94 to 95% greater chance of getting COVID than the patients who received vaccine. More importantly, of the few people who did get COVID who had been vaccinated, there were no severe infections reported. In other words, those patients didn't need to go to the hospital or land in the ICU with COVID disease. The duration of effectiveness is something we're still learning about, and we'll continue these studies through the year to have a better understanding of how long the antibody levels and the effectiveness of the vaccines will last. So what is an emergency use authorization? The FDA studies used to approve these vaccines for emergency use follow the same process as the FDA normally uses to approve vaccines. An emergency use authorization is an early determination that given the pandemic, we have enough information on safety and effectiveness to make the call that the benefits outweigh the risks to use the vaccines at this time. So again, the vaccines were approved under EUA back in December. Those studies that were used to approve the vaccines will continue through this year, and the FDA will continue to track safety and effectiveness of the vaccines through this year. They'll continue to measure antibody levels in patients who had been vaccinated back in the fall, and they will continue to track the incidence of COVID disease, as we move through the calendar year. Vaccine providers, also are reporting any adverse events that occur in real time. So if a patient has an unusual side effect after being vaccinated or has a severe side effect after being vaccinated, we report that to the FDA immediately. Patients can also report their side effects to the FDA when you get vaccinated. You're given a link you can put on your phone and very easily and quickly receive a text from the FDA on a daily basis and report back what side effects you have and the severity of those side effects. This is a model of COVID-19 virus. And these protrusions on the outside of the virus are a model of the S protein or the spike protein on the outside of coronavirus. And so when somebody gets infected with COVID-19, our immune system recognizes the proteins on the outside of the virus as foreign, and our immune system makes antibodies against the different parts of the spike protein or the proteins on the outside of the virus. And that is one of the ways that our immune system fights the infection. When we vaccinate somebody, the vaccine just basically replicates the spike protein only and no other parts of the virus. Again, that basically tricks our immune system into developing antibodies against the spike protein. Those antibodies can persist in our system for months and hopefully years. If we are subsequently exposed to the COVID virus, our immune system will have antibodies that immediately recognize the spike protein and prevent the virus from taking hold and infecting us. So RNA technology is not completely new. Work has been done over the past more than a decade with RNA vaccines against SARS, MERS viruses, as well as influenza and rabies. This research greatly helped speed up the development of the vaccines last year. RNA is basically a blueprint of a specific protein. The RNA in the vaccine is an engineered blueprint for the spike protein found on COVID virus. The vaccine delivers the RNA to some of our cells make spike protein, and our immune system creates antibodies that will then be ready to identify and attack COVID virus if we are subsequently exposed. Our own cells routinely use and then discard RNA after a short period of time, and that's what happens to the RNA in the vaccine. The vaccine does not contain DNA and cannot affect your DNA. You cannot get COVID from RNA vaccines, and there are no live virus in the vaccine. The safety profiles of the vaccines are relatively favorable. The common side effects are largely rated as mild to moderate in the studies used to approve the vaccines. The common side effects are not self-limiting and are not dangerous. Allergic reactions can happen in about 1% of patients. More severe anaphylactic reactions occur in about 1 in 100,000 patients, and those numbers are fairly consistent with other vaccines. So the side effects that can occur would be fever, fatigue, headache, chills, muscle and joint pain. Pain at the injection site can occur in about 4 out of 5 people. And the vaccine side effects occur more commonly with the second dose. So for fever, 3 to 4% with the first dose. About 16% of the people might get a fever with the second dose, generally a low-grade fever. All of these side effects, again, are self-limiting, typically last 1 or 2 days, sometimes 3 or 4 days. And they vary a lot from person to person. So many people only have a sore arm, and a few other unlucky people may be feeling a bit miserable for a day or two. Some reasons to consider vaccination. A few reasons to consider vaccination. The vaccines do appear to be safe and effective per large clinical trials. And while COVID is often mild and self-limiting, it is very unpredictable and it can be very severe, and sometimes even in young and relatively healthy people. Post-viral syndromes or prolonged recovery from COVID is a very real thing, often affecting young and healthy people. Heart failure, fatigue, forgetfulness, brain fog, nerve pain, and headache are common ailments that people deal with for often months after sometimes only moderate COVID infection. Some of our teaching hospitals across the country are beginning to put together programs or have established programs to study as well as treat people with post-COVID syndromes. A couple more reasons to consider vaccination would be to protect our vulnerable neighbors, family, and coworkers, to help our friends who are trying to work at or run a business, and the vaccines can help accomplish herd immunity and really are our best, most likely path back to normal so that we can attend sporting events, family get-togethers, and go to dinner without being worried about getting COVID or sharing COVID if we're infected. When I speak about herd immunity, that is basically when enough people in our communities have been vaccinated or possibly have had COVID so that most of the people around us have antibodies against COVID, and then it's less likely that the virus can be shared from person to person throughout the community. I want to just briefly touch on the new COVID-19 variants that we're hearing a little bit about that are starting to get established around the United States. Some of the variants are definitely known to be more transmissible. In other words, when they get established in a community, the rate of transmission and the number of people infected is going to increase or could increase. And some data is suggesting that some of the variants may be more virulent. In other words, they may make people more sick. Vaccination of our population can reduce the spread of variants. And so while we're working to get our communities vaccinated and get people vaccinated, it's really as important as ever that we practice masking, distancing, and avoid crowds and gatherings to try to keep these new variants from spreading and becoming established in our communities. So our local health departments right now today are working hard to vaccinate people in phase 1B, persons 65 years of age and older, and essential workers. You can sign up, or your family members can sign up for COVID vaccination at your local county health department website. And KSB is working currently with Lee and Ogle counties to help vaccinate people in our area. KSB is using the local health department lists to schedule patients for vaccination when we have vaccine available. If you go to ksbhospital.com, the KSB website, you'll see here the KSB COVID Hub. And there you can find links to the local health department forms for signing up for vaccination, along with a lot of other good information and local information about COVID vaccination and COVID in general. So thank you for taking some time to learn about COVID vaccines and for educating yourself to make a good decision about vaccination. And thank you again to KSB Community Wellness for organizing this program.